Well, we have a very special guest with us at this point in time. This is the South African doctor who actually first discovered this strain of this variant of COVID. In fact, is joining us here on Mirror Now. We've got with us Dr. Angelique Coetzee at this point in time, a South African Medical Association chair as well. Thank you very much, Dr. Angelique, for speaking to us here on Mirror Now. Appreciate you taking the time out. If you can first tell us, about when you discovered this variant the first time, what happened and what was your first impression?
Good day to you and your listeners and viewers out there. So, I didn't discover the strain. I just clinically noticed that there was a difference. Yes. What one needs to understand is that clinically, the picture is not the same as the Delta variant. They're all COVID variants, So I just need to say, when we say that it's not the same, we actually mean to say that when you get this, you normally we will see from day 5 to up till day 10 after you have contacted this virus, if it was a Delta, that you get severe, your chances of getting really, really ill are highly, it's much more. But if you get this variant for now, this is what we see now, but it's going to take about 3 to 4 weeks before we really know what the immune responses on some of these other the patients are going to do, which doesn't look very ill. So again, if you look clinically, it's mild symptoms, what we call mild symptoms. But interesting enough, we are seeing this last few days that the people who had been vaccinated getting breakthrough infections. So when we say it's mild symptoms, let's say you come into my surgery with a headache and fatigue, the unvaccinated, that's a specific age groups, they have more headache and more severe fatigue than the vaccinated people. So for me, that's also a good news, because it seems that although you can get your infection, even though you have been vaccinated, it might seem at this stage, it's very, very early, but it might seem that your symptoms are not as worse than those that's unvaccinated. And the vaccines are very important.
Yes. And with regard to the vaccines, of course, there is still a lot that needs to be studied as far as this variant is concerned. But how likely would it be that, the current vaccine plethora that we have across the world is going to be sufficient for this variant?
Well, I can speak on behalf of what we see in the vaccines that we're using. So we use Johnson & Johnson and Pfizer. And for now, the breakthrough infections on these vaccines, we haven't seen severe cases, and we're not aware of the hospital admissions that people have been vaccinated and have severe disease. We're not talking about severe disease. For people on those two vaccines, I'm very happy. But again, it's early days. We still need to go about another 2 weeks. We're trying to say between 3 and 4 weeks. Otherwise, everyone is on our cases. Mm-hmm. But if you're vaccinated, it's definitely going. It seems at this stage that you're still the same story, about 94% protection against severe disease. However, we have never said you won't get mild disease, and you will, but it seems that the mild disease, the symptoms are milder than the unvaccinated people. So that's good. And even the reinfected people who've not been vaccinated, we can also see that their clinical picture is, also not as severe. So I think there's protection. So it's not protecting you fully 100%. But at least there's a real good case to make out of getting vaccinated.
Yes. And at this point in time, we are talking about around 300 to 350 odd cases world over at this point, which is not a very big number to really study the variant and see the kind of, the effect and impact that it could possibly have How do you see the kind of impact that this variant could possibly have with what information we know in terms of the transmissibility? We do know that at least so far the infections have not been severe. But again, that would be too early to sort of come up with a conclusion that this variant doesn't cause severe infections, right?
Yes, fully agree with you. It's still too early regarding severe infections. But what we see, is a very fast spreading virus, transmissible, very fast spreading. Our modelers said to us that I think that we will have quite a steady curve, upwards curve around up until middle of December, and then we will see what happens then. If I can give you the values of yesterday, we saw 16,055 positive cases, but then remember, we yesterday tested 65,900, nearly 66,000 people. Mm-hmm. And of that 66,000 people, 16,000 were positive. And the day before yesterday, we tested 51,000 and 11,000 were positive. So between Thursday and Friday, we had 22.4, and then we went up to 22.3. But we have made our people very aware of, please get tested. And so this is high numbers of people getting tested, and it's right, it must be like that. We also need to say, what do we know about this variant? You can pick it up on the PCR test. That's a normal test that's quite expensive. And then you have the rapid test. And if you do it within the first 24 to about 5 days after symptoms, that might also pick up the virus. If you do it too early, if you do it too late, that rapid test might be false negative. But your PCR, it's easy for the PCR test because there's normally 3 genes that they need to test for, which is indicative of the COVID family, of the corona family. And what we have seen now is that it is just a godsend that the S gene, there's a fallout. So it means on a normal PCR test, they can immediately pick it up. You don't need to go and do sequencing. So hopefully that will also assist us with data going forward.
Yes, absolutely. Some extremely important points that you've raised and talked about here. The other aspect, I wanted to just delve into a little bit about how the Omicron variant compares to the Delta variant, because at least if I talk about India, the Delta variant is what caused the massive second wave, which was extremely deadly. In terms of the transmissibility factor specifically, how would both these variants compare at this point in time?
So again, if you look at all the different variants, Delta replaced all the others. So Delta was quite, or is still, don't forget, it's not gone yet, it's still there, very transmissible. And it seems at this stage that the Omicron is just as transmissible than Delta. Whether it's more, we will see going forward. But the steep rise is a bit different. So it means in a short time, it infects more people, people getting more clinical picture, but the real immune, because remember, this is a virus that attacks your immune system, and it's more a respiratory tract problems that you will experience as you go forward. So I'm just trying to get my words right so that the average person also can understand.
Yes.
And that type of inflammation in the body, let's say you get a mild infection and you're not totally over it, so we still need to wait for another week or 2 weeks, as I've said, 2 to 3 weeks, that's maybe better, to see what your inflammation response is going to be. So if 1 month from now on, it's still, although it's a steep curve, but there's not a lot of people dying, not a lot of people admitted to hospital and oxygen and all of that, then we will all say, thank you so much. This is a fast-spreading virus with less virulency, but we will only know that in another few weeks from now on. But so far, so good. Let's see and hope it and pray it stays like that.
Right, absolutely. But Dr. Angelique, from what I understand of what you've said, is that despite the fact that this could cause or this could be highly transmissible and we could see it rapidly spreading, it doesn't necessarily mean that it could lead to more severe infections or even to the extent that we saw in the Delta variant. Is that right?
Yes. That's what we say. And we say it's early days, so we need to look and watch that space. It's early, but it seems definitely that it gives you in a short period of time a steep rise or incline in your numbers, and whether it will be that severe in the end, you need a few more days to say that. But for now, again, it's mostly mild cases. And I want to say again, because there's a misunderstanding out there that if we say mild cases,
yes,
that it means you don't need to go and get vaccinated and the vaccines is not working. That's not what we say. We are saying the cases is mild because we don't need to admit you. We're not saying don't go and get vaccinated. We don't say the vaccines are not working. We're just trying to say to you, please don't panic at this stage. We can handle it. And I'm quite sure your authorities and your doctors would also be able to handle it. Remember, we came from a very, very bad viral infection with the Delta. The Delta was fast spreading, but people really got very, very sick on Delta. And I think it's so in our minds what we have seen that we don't want that. We don't want ever to see that or be in that situation. Neither patients, neither doctors, neither any government. So let's see. But the beauty of all of this, and I'm going to say it again and again and again, by you wearing your mask, by staying away from crowded places, by getting your jab, those three very important measurements will save lives for sure. That I will put my head on the block for. And also, it doesn't help you wear a mask that's 3 days old and not been washed. You have to wash the mask, please, on a daily basis. Make sure that your masks are clean. And don't wear your mask here, because your nose is also a place of where infection gets. Must be over the nose, please.
Yes, I think those important points can't be highlighted enough, and you know, time and time again, and especially with regard to remaining masked up and going and getting both vaccine doses that are required at this point in time, because it will help in may not help in completely eliminating or you know, letting you not get the infection, but at least a milder version if you do get the infection. But Dr. Angelique, as far as you know, South Africa is concerned, can you give us a bit of an insight about what you have been witnessing there in terms of the symptoms, whether the patients maybe have mild symptoms, but do they need things like oxygen support? Is that something that's being recommended? What are you seeing there?
Thank you so much for that question, because that's where we are working on a daily basis, and that's what I know the best. Very mild symptoms, meaning they come in with a body ache and pain. My body is not feeling well. I've got the shoulder pain. I'm not feeling well. So body aches and pain. I'm tired, fatigue for a day or two. And interesting, there's a headache as well that is now starting to emerge. They will say to you, I've got a very, very bad headache, doctor. I'm fatigued. I want to sleep. And my body is just so tired and weak. And the headache, and I can have a bit of a scratchy throat. Doctor, it's as if something is sitting here. They will show you there. And then also a cough, but it's not that. The cough is it's like an irritation type of cough, not very dominant. So you can easily miss these symptoms when a patient sits in front of you, because very seldom they will have high temperature. Very seldom they will have a pulse higher than 100. And so far, we have not seen patients needing any oxygen. Thank heavens for that, because that was a huge problem in our country with the third wave. We haven't seen that yet on the mild cases. So that's why we say it's mild. But let me tell you one thing, that headache and that fatigue is a headache and a fatigue. You will remember you've got it. And if you're not vaccinated and you get it, you will remember that you didn't vaccinate. That's why your headache is worse than your friend who has been vaccinated. It's those subtle type of things and symptoms. And therefore, we ask, even in your country, ask your people, if you have that feeling under the weather, not yourself for a day or two, go and get tested. Please, please, please. And then doctors, please don't expect a Delta patient sitting in front of you with severe disease. Just test this patient. Do not think this is a normal post-nasal drip of a sinus sitting in front of you. Yes. Please test, please.
Yes, absolutely. Dr. Angelique, the other question I had is, I mean, you did list out the kind of symptoms that you've seen over there with regard to the Omicron variant cases specifically. But is there a difference in symptoms, or because, I mean, we look at COVID as an overarching kind of infection. When we look at the various variants, would there be a difference in symptoms because of the variant? And is that also the case as far as Omicron is concerned?
Very good question as well. I haven't seen anyone. This is interesting as well, no loss of smell or taste. So the patient sitting in front of you with loss of smell or taste, most probably Delta. Haven't seen that with Omicron. In Delta, within 5 to 6 days, we could have already predicted that this patient is going to need oxygen, whether it's home oxygen, whether it's hospitalization. We saw that, especially after 10 days. You know that this patient is really getting ill. So in South Africa, what we noticed at primary healthcare level, between day 5 and day 10, we normally say that's when they're going to crash on you. If they're going to get difficult, severe symptoms, it will be during that time. If you can get your patient past day 14 and day 5, great, then they overeat. And we normally follow up the patients with the Delta variant about between, again, 5 to 7 days later, because we are aware of this and we needed to make sure. Now, in this case, what we have seen, right in the beginning, we follow the same protocols and we wanted the patients to come back. So of all the patients, 3 came back. The rest said to us, "Doctor, I'm not going to waste your time. I'm not going to come back, I'm fine." And we then said, "We accept that you're fine. If you're not okay, please then make an appointment and come back." Even the 3 that came back, they came back because they wanted to go have confirmation that they're okay. I also saw females pregnant. I've got 3 of them now, around about, interesting, all of them around about 20 weeks pregnancy. And they also do quite well at this stage, although there's not a lot that you can give. And then regarding the medication, your cortisone is still because it's an inflammatory disease, is still your important medication, or the most important medication. But we have seen you don't need to give these high dosages that we have prescribed for Delta patients. So, that's also a good sign. And antibiotics, we haven't really prescribed in this case to the patients, maybe in the first 2 or 3, because it was still fresh in your mind about Delta, and you don't want to go through that again, and you don't want the patient to go through that again. So again, it's really very conservative measurements that you take, and you guide the patient. You tell the patient, if I've made this diagnosis on you, you have to rest for at least 2 to 3 days. Don't do a lot of activities, because that can contribute to your fatigue. And if you're getting more exhausted when you want to go and shower or bath or whatever, stop. Go and rest. Mind that your pulse doesn't go over 100. If you think your oxygen is not okay, levels, please come and tell us. But again, so far, still early days, but we're coping and managing on very, very conservative measurements, which is important. The most important things, I think, is the prevention, and that is that masks and stay away from big crowds and get your jabs.
Yes. And Dr. Angelique, the other question here is that in India now we have 3 cases that have been reported of the Omicron variant, and the immediate measures that the state governments here are taking is to ensure that the contact tracing is done. All of those who came in contact with those patients are being put under isolation, being quarantined. So all of that is happening. Over there, what is the kind of measures that you follow when there are cases of Omicron that have been detected, in terms of containments, in terms of other precautions that need to be taken to protect the rest, the rest of the population?
Exactly what your government is now trying to do. We also keep on emphasizing the masks and the vaccines, but we do have, not about 40% of our adult population has been vaccinated. We would love to see much more people vaccinated. So our government is looking at compulsory vaccinations if you want to go into any indoor space going forward. And I don't think that's a bad idea, because you need to understand there's a lot of anti-vaxxers out there. And the first thing they will say is, look at the people. They got the jab, they got the vaccine, but they still got infected. So what's the use? What they don't understand is the clinical pictures are different. And if you are vaccinated, your chance of spreading the virus are severely diminished. It's around about 1/3. So if you're not vaccinated, you're actually a walking viral host out there. You will transmit nearly 100%. So that's also part of getting the people, to getting less transmission of the virus by vaccinating, the mask. One cannot believe that a simple mask can really add some value. It can. And stay away from crowds. Crowds and schools is important as well. Luckily, in South Africa, I think this is going to assist us greatly. Our schools are now starting to close and will only open the second week of January. And I think that will also be a blessing in disguise going forward.
All right, Dr. Angelique, I truly appreciate you taking the time and speaking to us and telling us all that you know and that you're seeing there in South Africa with regard to the Omicron variant. I can only truly hope that it remains at this stage and we manage to contain it at this point in time. Thank you so much for speaking to us.
Thank you so much. Please stay safe. Thanks.